I'm so glad that we can talk today. It's a far out, man. It's an absolute cracking read. Jesus. And
have you been through it?
Yeah. And look, as someone
I'm impressed.
Thank you. Like both my folks are doctors, so I grew up around it. I grew up around a lot of the stuff you write about. I've been through some grim mental health stuff myself. My wife is from Fiji. My wife is from Fiji, and
I did not know that.
Yeah,
wow.
yeah. And the only charity my dad ever donated to was Médecins Sans Frontières. So,
look at that.
Yeah, when I saw you come through, I'm like, dude, we got to talk to him. Come on. And, but it's an extraordinary story, and people might not think, oh yeah. It's a book written by a doctor. Why would I want to read that? But the lens that we rarely see the state of the world through the perspective of the humans that are living in it. We see it from the mouthpieces of the leaders of the countries, or the news services owned by the countries, or the journalists who might be staying in those countries, who are traveling everywhere with a fixer and with security and with, so we kind of almost get this hyper-real simulacrum version of what's actually happening on the ground.
That's a great way to put it.
It's true though, isn't it? Yeah.
Yep.
A doctor in a tent, delivering babies with a bag of saline and a wet wipe, they'll tell you exactly how it's going on. So I found it just incredible lens to have a look at the world, man, especially from a kid from Queensland. It was great.
Well, I appreciate you saying that, and for taking the time to have actually read the book prior to the interview. That means a lot to me. And I want to try and make this claim to you, without a hint of disingenuousness, that really the memoir genre was just the sort of logical strategy that I could use to try and highlight these issues and perspectives that I'm trying to trying to describe. But it's really not supposed to be a book about me. It's just sort of the vehicle by which to tell these stories of my colleagues and patients, and not even just patients, just people, communities out there in the world, in some of the most interesting and exotic and dangerous parts of the world from our perspective. That's just where they live. That's just their day-to-day life.
It's home.
From their perspective.
It's home.
Yeah.
That's where we live. That's where we live, and it's very dangerous to get water because of the hippos. That's it. That's where we live. That's where how we got here. But it's you're right. Yeah. It's an extraordinarily useful tool. It's to be able to tell that story. I mean, particularly, no one's going to click on a journal article about antibiotic resistance bacteria. No one's going to care about that shit. But reading
this was exactly my point. You've nailed my strategy. Where were you earlier on in this journey? I would have been a lot more efficient.
I would have told you to write a memoir.
Yeah, because I realised along the way, with the dabbling in academia and the pounding out PhD thesis and stuff, I was like, look, I'm very concerned about these issues, and I'm writing about them.
Yeah.
But the fact that I'm concerned, the fact that I'm writing about it, doesn't mean that anyone, is really going to read them or pay attention or take the steps necessary to try and sort out this mess. So it was really this compulsion that I felt to try and make the messages more accessible, and the fact that I quite enjoyed writing but felt hemmed in by the sort of academic literature genre that led to this book being born. And I'm just happy that it's out there now, and that a few people who are sort of willing to think about these things and discuss them like your excellent self are out there doing that. That's sort of mission accomplished from my perspective. We just need to make it get a lot further. Yeah.
Well, look, it's written in such a way that it pounds along, and because of the work that you've done, it's exciting situation in exciting part of the world, in dangerous situation, like page after page after page after page. And that's, here in Australia as well. So it's not like it's and now here's the 500 reasons about why this is bad. It's like, oh, by the way, before we talk about Congo, here's a quick lesson on Leopold II. He was a right cunt, and fucking, it's fucking great. He was. Just
for the listeners out there, that's Osher's rephrasing of my
not enough
more, baroque description.
People think Congo, people just if you want to have a look at what colonialism, how much of a shit
looks like at its worst
colonialism can become and will become if the resource is valuable enough to the people who are extracting it, that's what'll happen. And it's grim, but it's worth it to have a look at what actually happened there. And then, what's that look like in PNG, for example? What is it's happening today in some parts of the world around, some minerals and mining and stuff like that. It's important to have that look. We should talk a little bit about how you came to be on this path, if you don't mind. You grew up.
Sure, that's what we're here for.
Thanks, man. You grew up a couple 100 k's inland from the Whitsunday coast, in this a lovely little odd Queensland town. How many people do you reckon? 200-300, if that?
Yeah, there's definitely that at the time. Yeah, most of whom I was related to.
Yeah, right. Cattle country in that part of the world. And look, as a kid, I only know a bit of Adelaide, mostly Brisbane. I only know that. You only know what you know.
Exactly.
When did you realise that the world you grew up in and the school you went to was kind of different from the rest of the world?
It was more this realization that there was the rest of the world out there,
right?
That really kind of got me fired up. And it's not easy, as anyone who's grown up in a small town can probably appreciate. It's one thing to acknowledge that there is a big wide world out there. It's quite another to actually get out there and see it for yourself. I mean, you've got to have the will, you've got to have the resources. You've got to sort of find a way to, I don't want to say escape exactly, but just to take that big step. But I was fortunate enough in my final year of high school to really catch a break in the form of this quite incredible program called the National Youth Science Forum. My feelings about it are nuanced in retrospect, because there was some slightly eerie aspects of the program. But overall, it really accomplished a lot in terms of giving kids around the country in their final year of high school, with a sort of positive discrimination towards country kids, the opportunity to get together in Canberra for a couple of weeks, basically this sort of festival of up-and-coming science nerds, where we were not only encouraged to sort of get to know each other and see a bit of what was out there in terms of career opportunities and whatnot, but we were actually kind of helped along our way. We were trained in things like how to do interviews and how to present a CV and this kind of stuff. We were really encouraged as kids with potential. And a few of us, at the conclusion of that annual program, were offered the opportunity to go overseas, be trained as staff members to run the program the following year. So, I'm a kid from Millaa Millaa, barely knowing anything else in my life apart from my farm and family and school, and off I'm sent to bloody Moscow in the late 90s. And it just melted my mind. It may have been another planet. And being there, we're hanging out with cosmonauts. We were guests of the All Russian Youth Aerospace Society.
Fuck yeah.
Toured around Europe in a train for a couple of weeks after that. I came back to Millaa Millaa, a completely changed person. And then 2 weeks later, my dad drops dead, and I find him on the side of the dirt road and the drizzle and the gravel. And I'm like, wow, this is some pretty hectic transition in life I'm going through at the moment.
These two extraordinarily powerful things happened in your life, so close to each other. It wasn't Moscow, and it wasn't Millaa Millaa, but I remember those first few days coming back to Brisbane after I'd first been overseas. It wasn't until my mid-20s, just going, oh, right, I'm going to have to do something about this.
This is a game changer. Yeah.
The book opens with the day you lost your father. It's wild though, because reading it, I'm like, I'm 3 months younger right now than he was when he died. I don't want to suppose it's extraordinary reading. So I don't want to blow it for anyone that's going to read it. But you discovered him, and it was clearly way past anything that anyone could do. And as often happens in remote parts of Australia, you had to wait way too long for help. But as someone who's been through something pretty intense, there was a scene there that just hit me in the chest. You go from this normal day to day, and you're dealing with this really intense, you're just going to your family stuff, right? And then suddenly a house is full of people who all want to talk to you, and everyone's holding a casserole. And I remember that and going, fuck, I don't know if I want to talk to everyone. and I don't know if I want to eat any more casserole.
Yeah.
And they just want to help.
It was an intense environment. Yeah. Yeah. I mean, that's country life for you, right? That's just a demonstration of how people, rally around each other in times of great need. The thing is, there was three of us in this horrible catastrophic situation. There was my mum, my sister, and me. And I wouldn't presume to speak for my sister, particularly not on a fabulously popular podcast like this. But I know, I can see how her experience was particularly difficult with that through that period, because mum, of course, was in many ways the centre of attention, and rightly so. I had just reached the point where I was semi-independent. I had friends that had had licenses and could drive and could sort of, come and whisk me away and, go and get drunk and sort of distract me. Whereas my sister was just sort of trapped there in this, horrible little cocoon. So that kind of trauma, and, everyone's got their own stories and trauma, right? But the effects at the time, or the experience at the time, can just lie dormant and manifest later. It's such a potentially sinister experience. I think we really need to be more aware of and compassionate about and thoughtful with respect to how we, I don't want to say treat trauma, but how we acknowledge and support different types of trauma, because it can just be in there in the brain. Years later, whoop, something pops up.
And then
nasty business.
The idea of having emergency responder psychologists is, I mean, this is late 90s we're talking this happened. So I've had an emergency response psychologist here on the show. It's a person whose job is to literally lie under the truck with the person who's pinned until the crane arrives.
Jeez.
And that's her job. And she's incredible at what she does, because it's like first aid talking. It's unbelievable and incredibly powerful for hopefully preventing like intense PTSD and things like this, which is astounding that kind of work even exists. But for anyone who's listening, I guess any doctor has seen a lot of death, particularly someone who's working in a remote, regional, and war-torn parts of the world. You've probably seen your fair amount of really, really sad and hard to deal with death. When you think about your own experience and what you've seen, what would you say is, if someone around us, like as a young man who's like, as you were 16, 17 years old, if the young man loses their father, now what do you kind of wish could have happened to you and all those kids that you've met along the way? What's the thing that we could maybe take from that and go, right, here's a way we haven't thought about yet?
Well, it's interesting you frame it like that, Osher, because I have asked myself, on multiple occasions throughout the last few years I've been working on this book project, and then I have been asked by people more recently, why did you write the book? Who did you have in mind as an audience? And I really don't want to sound glib here, but I didn't have pretensions as to how widely read or successful the book would be, and I was really quite certain that the most likely scenario upon completing this manuscript would be that my mum, my sister, and my then fiance, now wife, would probably be the entirety of my audience. But fundamentally, even if they never read it, I was writing it for that 16-year-old kid,
right?
That I was, because in that really intense and traumatic period that we were just discussing, one of the most dangerous, perilous, and uncomfortable aspects of all that was this feeling that I was just completely lost all of a sudden.
Yeah.
I was rudderless and directionless and purposeless. And if I have had at that time a book like that that I could read and go, okay, there is a life out there that I could lead that would be interesting and adventure-filled and rewarding, that would have been a very powerful motivator, I think, for me to kind of be able to just get up and soldier on. And what I certainly didn't appreciate at that time, but again in retrospect seems like, well, that's pretty obvious, is that became a recurring theme for me. When I was really struggling with with my sort of sense of self or mental health, it was this niggling little issue of what am I doing here? And on the converse side, this sense of purposelessness that I found most most inclined to lead me down the slippery slope into depression or whatever. So there's a roundabout way of answering your question. I think for folks out there who might be struggling with why they're here, what they're doing, particularly if they're at that really formative period. Adolescence is a tricky time, right? We're all just, our little brains are being molded by any kind of influence, positive or negative. It's if you emerge from that with your shit together, you're doing well.
Yeah.
And I think, just having being able to share with people, including country kids like me. There is a world out there. There are amazing things that you can do with your life. Don't feel that what you see immediately in front of you is all that there is. Get out there, get stuck in, get involved, and you can kind of create opportunity, and life can be very interesting and rewarding.
Time becomes a very difficult thing to think about when you're in those moments. You are so stuck in this. But this person was literally just okay yesterday, and now they are not okay. Now I'm talking broadly, like somebody might have suddenly been diagnosed with something and your brain keeps sucking you back to a time that doesn't exist anymore when everything was fine. And now you struggle going, but why is this person can't walk or whatever, they're not here, and it's so hard. What, if anything, have you found that can help yourself or the people you're working with kind of get out and kind of zoom out a bit from that moment?
I'm really digging this conversation, Osher. You're touching on a lot of the points that I find most fascinating. I'm also middle age, right? Time, the concept of time, and the concept / reality of death are two things that I hesitate to say preoccupied with, because it seems like it's kind of an unhealthy preoccupation, but that I'm being a bit more conscious of and discussing and trying to make my own peace with. And obviously they're linked, right? Like we are all just either slowly marching or absolutely hurtling towards the end. We don't know when it's going to be, generally speaking. And it's certainly a lot more visceral and real when you are a doctor or someone else who deals with death on a regular basis. It's like it's very confronting. And you inevitably absorb some of the trauma of that experience of caring for someone or being confronted with someone who was alive and is now dead. And that, as you were saying, that can be a very, very rapid transition from one to the other, which makes it all the more shocking, I think. But there's this beautiful little quote from Confucius, of all people, that you might know, that I'm reflecting on more lately. He was around in whatever year 600, 700. So this thinking goes back quite a ways. He says we all have two lives, and the second starts when we realize we only have one. And so, to me, then this concept of time and the reality of death can be just ever so slightly but beautifully offset by this acknowledgement that if I don't take for granted, every day that I'm here and every kind of opportunity that I have to be with my loved ones and do interesting things. If I don't take that for granted, then I'm living the most kind of considered and complete life that I can.
I remember one of the more, and this is the last thing I'll mention on time, but it just kind of struck me that one of the things that really, really helped me was a person who was describing, I was quite worried about a imagined traumatic event that actually never happened. But they said to me, look, even if it does, there's the day after, and then there's the week after, and the month after, and then the year after, and then 5 years after, and then there's 10 years after. And it really helped me because I was so focused on that fear of this thing happening, and there was just blackness on the other side. The really, like, never-ending story. It was like the nothing on the other side of this. And it really allowed me to go, well, like, I guess I'll have to go get groceries from somewhere, or, I'll still have to shower. It's just little like dumb day-to-day stuff. Once I started putting that into my kind of rigid kind of thing, it allowed me to kind of be a little wider lens on that stuff. And I found that really, really powerful. I don't want to stay in this space for too long, but I just, considering you do what you do for a job, I rarely get the chance to speak to someone who's, just dealing with the reality of humanity, which is the other half. Birth is the really fun part. There's parties, there's engagements, there's burnouts with blue smoke. There's all kinds of fun things around birth. And we pretend the other one doesn't exist, and we keep buying shit to try and make it feel further away. But did meditate on your own death?
Certainly cogitate on it. Meditate would probably be overstating my practice, but it's something I would like to work towards for sure. But I'll give you the scoop here, Osher. It is a subject about which I'm sufficiently interested and willing to invest my time and energy that I think it has the potential to, be worked up into a second book. So you heard it first, man.
Mate. But I think it's, for me, that the denial of death is nearly everything. Not everything, but nearly everything. And being an acceptance of death is so extraordinarily freeing.
So it'd be this sort of nirvana state. I agree.
I'm not there. I'm not in nirvana state, dude. I'm not in nirvana state. But just understanding that, it ends.
Yeah,
is so.
And what I find really refreshing, going back to that earlier conversation we were having about the privilege of being able to travel and sort of get glimpses into other cultures. So my wife's Mexican, right, and they have a completely different perspective on death, and it is something that is it's considered an inevitability, and people who pass away are mourned by their loved ones, but it's treated very differently, and there's a lot less grief, I would say. And I say this, from the naive perspective of someone from outside the culture, but who is connected to it and adores it. It is more celebrated in a way, and people who have passed away are still considered very, very present. In a day-to-day sense,
and with them every May.
Sure. Yeah, exactly. And so my point, I guess, is that even that perspective that I might have, being terrified of death and sort of give me the screaming heebie-jeebies, that's also very sort of it's got a cultural bias that informs that view. Yeah. So I mean, we can move on to more cheery topics. I suppose
it's not. The next place I want to go is not very cheery at all. But you've been so many parts of the world that are rough neighborhoods, to say the least. South Sudan,
rough neighborhoods,
the Democratic Republic of Congo. Like it or not, as much as the beautiful Instagram influencers photos might show us, parts of our Pacific Island neighbours are absolute poverty, and it's hard to accept, and it is just over there. And the book does go into the challenges of healthcare in parts of the world that are, as we would think, really challenging. Yet I think it's important, as we as Australians are starting to face towards a referendum around our Indigenous Australians, that we have a really honest, hard look at healthcare and health outcomes of the people who this country belongs to and was taken from, and their culture and practices and traditional ways. Many of the ways that these people kept healthy, kept their mental health in check, kept their families healthy, were ingrained in cultural practices. And then along come the British and the Europeans, and it's all gone. You have spent time in the Torres Strait, you spent time in the Kimberley, you spent time in Central Australia. What does Australia need to know about the healthcare outcomes for First Nations Aboriginal Australians?
Well, that's a big topic, and I really want to put a massive disclaimer up front here. I should say I don't pretend to be an expert in this stuff. Okay, I've spent years working in communities in the regions you mentioned. I'm a rural generalist and a public health physician, someone who has done research into these problems. It still doesn't make me an expert, but I'm interested in the topic and have seen a lot, and I think it is still seriously seriously underestimated problem in terms of the scale in Australia and the complexity of the solutions required. So let's look at something that's supposed to be on the face of it reasonably straightforward, like the life expectancy, or specific life expectancy gap. So, as you and most folks listening would be aware, I'm sure, there has been for a long time an extraordinary and grossly unacceptable difference in life expectancy between Indigenous and non-Indigenous Australians. Hence things like the Close the Gap initiative, which was specifically designed as a policy to try and address this. That has made minimal progress in over a decade. And that in part reflects the complexity of the problem, right? In the space of very few generations, Indigenous people in Australia and in the Pacific and around the world. I'm not trying to say that, this is a homogenous group, but I'm saying there are definite similarities in terms of the lived experience of Indigenous peoples around the world in the colonial era, let's say.
Yeah.
And it has been basically what we refer to, at least in the Pacific, as the triple whammy. You've got the historical burden of illnesses, particularly infectious diseases, coupled with this colossal burden of non-communicable diseases. So this explosion of chronic diseases like obesity, diabetes, heart disease, respiratory disease, kidney disease, and cancers that has been largely responsible for the difference in life expectancy between Indigenous and non-Indigenous people. And also, we're at this very scary point in our human history where there are certain societies, and I give the example in the book of Nauru, where that chronic disease crisis is causing a decrease in life expectancy. This is unprecedented in modern human history. These are not countries that are, in the middle of a civil war or being affected by the AIDS crisis, for example. This is chronic diseases. This is a consequence of loss of traditional lifestyles, being forced to basically become dependent on energy-dense, nutrient-free foods. And in places like the Torres Strait, where I've treated teenagers having heart attacks.
What?
In such, yeah, and through it. This is not some sort of rare genetic disposition they've got. This is just they have the cumulative effects of smoking and high blood pressure and high cholesterol and perhaps diabetes. And there's people around who are in their teens and 20s who have the coronary arteries or kidneys of people in their 40s and 50s and 60s. And this is largely the fault of colonialization, basically. And I try to not be too kind of obnoxious and aggressive about this in the book. Try to demonstrate through examples. I've worked in plenty of Indigenous communities in Australia, and when you visit these communities and you are hungry, there is usually one place where you can go and get food, and that one place is the community store, and the food there is expensive and terrible. And of course, if I lived here, I would also, be overweight and have cardiovascular disease, respiratory disease, kidney disease. It's not because Indigenous people, by and large, don't want to be healthy. Of course, they do. They oftentimes don't have the choice and resources. And so this is the real travesty, I think. So again, I describe in the book how I got quite involved in a project looking at the causes of avoidable mortality. Why were there different rates of early deaths in different communities around Australia? And why, surprise, surprise, were the highest rates in remote communities and the relatively highest rates in remote Indigenous communities? And I sort of did all this fancy statistical trickery with all the data that we could dredge up from different sources and surveys and stuff. And what it boiled down to was the reason people are dying unnecessarily and young is because of differences in water, sanitation, hygiene, nutrition, education, employment, housing. It's like, well, anyone could have told you that, right? But having those kind of obvious answers does not lead very, very quickly or easily to having obvious solutions to the problem. So it's pretty difficult, I find, not to get pretty cynical and depressed about it. And because it's so bloody complicated, that's why we have seen a pretty pathetic decrease in the life expectancy gap despite these highfalutin policies being put in place and really earnest efforts by many people over many years to try and correct it, we haven't made a lot of progress.
It is extraordinarily hard because you cannot, and I'm not saying you shouldn't. I mean, as far as I'm concerned, if you live in a community that's 200 k's northwest of Alice Springs, you should be able to have the same access to healthcare that I do living in the middle of Sydney. You're an Australian just like me.
And fresh, nutritious food.
Fuck
and
yeah.
Safe housing
that
and
I can
water,
eat.
sanitation,
and
hygiene.
A school and everything. Like we would not ever let our kids think that's okay. And if at the same time the things that used to keep me healthy, traditional cultural practices, hunting and farming, are completely not available to me because of grazing and mining and things like that, where I can't walk on the lands that I know all the songs about. I know all the songs where I can get the food, but I'm not allowed to go there. It's not okay.
It's not okay, but I really want to be very careful and conscious, Osher. We're a couple of white fellas sitting here talking about these problems
from Queensland. From Queensland.
Yeah. So, like,
you're without a doubt, dude. You're 100% right.
Yeah, there are people out there who understand these issues with a lot more sort of depth and nuance. But still, I feel like in our Australian society, there's not enough awareness of how serious the problems are and what the underlying causes are. And so that's why I think we can justify having these kind of conversations, and why I write about that stuff in the book.
The short version is, as you just mentioned, nobody listening to this would want their family or their kids to grow up with the access to health, education, water, sanitation, and nutrition that we expect Australians in that part of our country to live by. But that's their home. Why would they ever leave? And that's
exactly.
We would
difficult.
It's hard,
dude. Square.
But it's really hard for us to accept. But I think it is in accepting this kind of stuff and just being with how uncomfortable it is. For me, that's the first step to start to walk towards what it is we need to start to come to grips with, and how we might try to make it more right for more people as a country, to share the dignity that we would expect as Australians with everybody, including the people that were here before white people got here. But that's
I agree.
That's just me saying that. It's hard. It's hard. It's so hard. I don't envy anyone who makes policy in this area at all.
No, it's complex, and even from my tiny little individual perspective, I was working in this field. I was engaging in this kind of research, and the complexity of it got the better of me too. I'm like, shit, I'm not sure I can do this. This is so difficult and so depressing that I'm not sure I've got the guts to continue working on it. So I decided I'm trying to tackle climate change. I've just got rocks in my head, right?
Here's an easier one. When I was living in America, I saw an ad for, I think, World Vision, and it had Aboriginal kids in it. I'm like, we don't see those ads in Australia, but there they are. We like to think that as Australia, we don't have charities that are raising money to operate health. We think, oh, no, I'm giving my money to Rodney, who lives there in Uganda, and gee, I'm doing good with, like, they run those ads about kids in our country, in other countries. There you go.
Well, it's disgraceful, And Australia, unfortunately, is just kind of basically doing the worst of any country in terms of this non-Indigenous health gap of any comparable country that is wealthy and developed but has an Indigenous community. We're the worst. So,
So
think about that.
Dealing with, Indigenous Australia's health outcomes, you're like, this isn't tricky enough. I need something way harder, coupled with entire cultural practices and senses of identity as a nation. What should I go for? I know, climate change. Well, let's go. When did you first, as a kid or a young man, when did you first start to become aware? I mean, I'm a bit older than you, so I was very, very aware about the Montreal protocols, CFCs, and all the first talk of global warming, greenhouse gases, the greenhouse effect, atmospheric effects upon warming was all over the news. And then they went, and we did it. Hooray, 1992, we signed the deal, we're done, guys, well done, job work, well done, guys. I can't remember when it was, Montreal protocol, whenever it was. So I was quite aware about it from young. When did you first start to kind of go, it's a bit odd, it's not good?
Well, I mean, our age difference isn't that great. Things like, ozone depletion, we were taught at school, global warming, we were taught at school, but still it came as a shock to me to see particularly the carbon emissions and global warming, global heating, as it's now more accurately called, come up as a public health issue. So I sort of stumbled across this in a way. I was doing my first public health job in the Kimberley. It was in my second year after I finished uni. I was trying to decide whether I was going to become an emergency physician or maybe do something in public health. I didn't know what that was even. But I was trying to decide between these two specialties, which are basically the opposite ends of the specialty spectrum. One's like treating people at their sickest, and one's trying to stop them getting sick in the first place. But for some bizarre reason, they were the two things that appealed to me. And I was kind of had this really interesting job in the Kimberley where on the one hand, I was looking at the infectious disease sort of surveillance database and monitoring and responding to epidemics, involved in vaccination programs and sexual health, health promotion, this kind of stuff. But for some reason, I got interested in Ross River virus. Yeah, for anyone that's not heard of it, it's a virus spread by mosquitoes. It's endemic to certain parts of Australia in the tropics. And because I had access to this database, I could see that the patterns of Ross River virus disease in that part of the Kimberley, they were quite predictable, but they were changing over time, and they were very closely linked to the temperature, rainfall, and humidity conditions. I was like, okay, well, that, reading about it, that makes sense because, the mosquitoes breed when it's hot and wet, and the virus replicates, when it's particularly humid and humans are exposed and epidemics occur, blah, blah, blah. And then the more I kind of read about it and thought about it, I was like, well, hang on, if this is changing over time and we've got this climate change in the background, what does it mean for the future as conditions are becoming hotter and wetter and potentially more humid? And I sort of disappeared down this rabbit hole. It's like, this is all really bad news, not just Ross River virus. Yeah. Pretty much all infectious diseases have the potential to get worse due to climate change, and not just infectious diseases, non-communicable diseases, traumatic injuries, deaths from extreme weather events, the Pandora's box of mental health problems that are all like just thundering towards us due to climate change. I was like, hang on, I'm working in a public health job. I've just graduated from medical school. How is this the first time I'm hearing about this? And by the way, why isn't everyone else talking about this? So how is this something that's just kind of popped up on my radar? And I realized, of course, that it wasn't just me. There were some very clever people in Australia and around the world, really like not just kind of sounding the alarm, but like swinging on the bell, trying to summon the world's townspeople to get their attention, including some real leaders in the field who were based in Australia at the time, right up to the headquarters of the World Health Organization here in Switzerland. I was like, holy shit, this is really scary stuff that is not getting anywhere near the attention it deserves. So that was, a little nightmarish period I went through for a while, working up the Kimberley going, shit, what am I going to do with this information?
It is hard. I'd like to talk about it for a second because I've been touching upon this on this show. It's okay. My period of that, I ended up actually going proper crazy. I had to get on antipsychotics because I was starting to hallucinate that it was all happening right now. Well, but it's okay to be really fucked up about it. It's okay to be just floored with grief and Jesus fuck. It's okay to have that period of just staring at the wall for a while. You got to.
Well, so I did in a way and tried to channel that in a constructive manner, and so joined a great organisation called Doctors for the Environment Australia. So they're kind of the Australian chapter of a global organisation that has similar sort of missions and objectives. But then I kind of had to just stash that in the back of my brain for a while because I was still working in different parts of Australia, finishing my training and the rest of it. But by the time I was approaching the end of my first round of specialty training to become a rural generalist, I was working up the Torres Strait. I was finishing off my Master of Public Health, Tropical Medicine, doing a bit more research. This is kind of, popped up again for me. And I was like, well, I'm not quite sure what I'm going to do with my career once I finish my final exams, get my fellowship. Then I'm kind of free to do something else. I always thought I'd go and work overseas and do something. That wasn't clear to me. And then this job with the World Health Organization popped up in the South Pacific, working on climate change and health. I was like, okay, well, eureka in a way. This is going to be pretty wild, but let's give it a go. And then I spent the next 2 years roaming around the Pacific, working on this 12-country project, trying to figure out what each country's particular risks were and what they were already experiencing in terms of health impacts of climate change, and try and put in place some reasonably sensible and feasible action plans to try and avoid the worst of those impacts. And as I'm doing this, I'm having this kind of, again, this weird experience that you were just describing. I'm like, why isn't everyone else as worried about this as I am? And I'd connect with these people who are working in that same field. They're like, yeah, man, I get it. Yeah, fuck, if only everyone else knew what we knew.
Yeah.
But you feel almost like you're in this kind of crazy little intellectual cult. It's like this information isn't secret. It's available.
Yeah.
And then you've got these absolute lunatics out there like denying it. I mean, God, climate change denial is just such an absurd luxury. I just cannot get my head around it. There are only people who are able to indulge in that. Rich wankers in wealthy countries who have the ability to clothe and feed and air condition themselves, while millions of people out there, sweat and suffer and die. So there's this huge collective cognitive dissonance on the topic that is really spooky when you connect with someone else. It's like, yeah, man, I get it. Shit house, isn't it? Yeah.
Yeah. It's wild. And framing climate change as a public health, that's just one of the, many issues. You could frame it as a food security issue. You could frame it as a housing issue. You could frame it as anything. But is it going to be a public health issue? Is it going to be when, I don't know, the climate changes so much that the dengue mosquitoes can now survive in Australia, and then suddenly Townsville, Rocky, Brisbane are just floored with dengue? It's like, oh, we better do something about this now. Is it going to take something like that?
Well, it already is a public health emergency. It's acknowledged as that. So previous WHO Director General, Margaret Chan, categorised climate change very clearly as the most important global health challenge of the 21st century. Now, we've been a bit distracted with this COVID pandemic for the last few years, understandably.
Yeah.
But that biggest global health challenge of the 21st century, previous WHO Director General didn't have it wrong. That issue is still there. In fact, it's getting worse. And then there's these other issues like, air pollution and antimicrobial resistance we can get into if you want. It is a global health emergency. It is already causing, at a minimum, hundreds of thousands of absolutely avoidable deaths per year. And based on the best evidence we have, the best projections that we have, are that it is basically the health impacts of climate change, whether you're talking about infectious diseases, including diseases spread by mosquitoes, such as malaria and dengue and others, or waterborne diseases, or respiratory diseases, or non-communicable diseases, or trauma, or heat, or mental health. All of that is getting worse. The latest report you might be aware of from the Intergovernmental Panel on Climate Change. It's the largest scientific collaboration in the world.
It's a delightful read. It's a beautiful thing. It's fun.
Really uplifting. Yeah. So these are not people that are prone to melodrama. These are conservative scientists. Their role in this, under the UN Framework Convention for Climate Change and this intergovernmental panel that put together these reports every few years, their role is to synthesize and summarize the best available evidence out there. And in their latest reports, just come out the last 12 months, they're like, guys, it's worse than we ever predicted, and is getting worse faster than we ever sort of dared to believe. And we are way behind on what is required to slow, halt, and reverse this process. And that includes the health impacts, right? So my little mission, with my work, with my PhD, and now with this book, is to really try and highlight the fact that climate change is causing negative impacts on our health. And this is everybody's health, not just people living in remote areas or, Pacific Islands, whatever. And it's not some distant future, hypothetical, abstract thing. It's happening right now. And I have to believe, because otherwise it's the only way I can kind of stay sane and get out of bed in the morning, is that message has to have some resonance with many people, hopefully the majority of people. Even if you don't really care about the fact that the planet's heating and the seas are rising and, fisheries and crops are dying off, all the rest of it. Even if you don't care about that, if your family or your community is going to suffer and die early and unnecessarily because of climate change, does that mean something to you, even if nothing else does? It should.
And this is the thing, like, to try to think about it. I think I've heard the climate change problem described as a hyper object. It's so massive you can't actually conceive it. It's like it's so big. You're like, it's so. Is the footy season? Oh no, basketball's on. That's good.
Yeah.
Kings
Natural
are doing
reaction.
well. It's too big to think. It's so massively humongous, and it's also depersonalized because it is so big. The oceans are rising. Okay, the ski seasons are going to get shorter by 85 days. Meh. Flooding. Parts of Australia, big no shit. Other parts of Australia, meh. I might have like horrific malaria, and my kids might die because of a mosquito in a part of the world that's never had that before. But I wonder. And this is where I guess where the rubber meets the road. Insurance is the other one. In a country like Australia, where there's a national healthcare system, which we unfortunately take for granted, but is probably the most vital, incredible, precious asset our country has. When the financial burden of those diseases upon our public health system starts to get too humongous, it's terrible. But do you think, will that tick the needle? Was that push things along?
Look, it's interesting to look at it from the Australian perspective, because it's probably not going to be malaria that really gets people's attention in Australia, despite the fact that the effect of climate change on malaria, or on mosquitoes that spread malaria, is, according to the best calculations estimates we have, already causing the unnecessary death of 50 children under 5 every day in sub-Saharan Africa, right? But that's not a problem that's going to affect most Australians. Dengue fever is the other example that you mentioned, right? So that has increased several times over in terms of magnitude in the last few decades, and it is projected over the next couple of decades to increase in terms of the people exposed to dengue fever annually, to increase by 1 billion. An extra billion people exposed to dengue because of how climate change is altering the habitats of the mosquito, the viral replication inside it, and the biting behaviours that cause it to humans to be exposed to it. Still, that's unlikely to be the thing that, as you say, moves the needle in Australia. But we are already seeing, if we're paying attention, what some of the more sort of sinister and localised effects of climate change in Australia are going to be, including on health. So, right, it is not it's not a surprise nor a coincidence that we're having this flood after flood after flood after flood. The temperature's rising, the sea is rising. Agriculture is becoming more unstable at a national level in terms
food
of
security,
the predictability of weather patterns, food security. Yeah. And I think most of us don't really appreciate that heat in particular is a big deal. We're a hot continent, and things are getting hotter, and heat, both the sort of steady increase in ambient temperature and heat waves as they become more frequent and or severe, is probably one of the most obvious single categories of health effect that Australians are likely to experience, and that's going to get a lot worse over time. Now, again, probably the majority of the Australians have the ability to protect themselves from those effects if they have, shelter and ventilation or whatever. But like most health emergencies or health problems, it's going to be the most vulnerable who are affected the worst. So the poor, the very old, the very young, the Indigenous people, those with pre-existing medical conditions, it's that same list who get hit by, whether it's a pandemic, whether it's a heat wave, whether it's some sort of, strain on the health system. It's those folks that are first and hardest hit.
What's the step forward? What's the step towards making this different?
So I guess if there was one objective that I was trying to achieve with this book, which is called Life and Death Decisions, it is enabling people to see more clearly that we are all connected and thus responsible in these life and death decisions, and the deaths in particular that are occurring all around the world every day. So, that title carries multiple layers of meaning, right? It refers to the work that doctors do, including rural doctors like myself. It refers to my own experiences, the dizzy ups and terrifying downs that I had with my mental health and being faced with taking my own life. It refers to the lived experience of many people around the world, as we've been discussing already in our fascinating chat, that they're faced with life and death decisions every day if they can't get food or water or be or shelter or be free from injury or attack or whatever. And then it also refers to the fact that we are all connected. So when we emit carbon, when we consume antibiotics, when we contribute to inequities and injustices in our health system that mean that, for example, Indigenous people suffer disproportionately and die young, that's all on us. And so all that my overarching objective with this book is to kind of illuminate those connections a bit more clearly and have people be more considerate in their actions about how they affect others, because I think we like to delude ourselves that our little life is in our little bubble and it doesn't affect anyone else, and neither does anyone else's lives affect us. That's a delusion, and it's a very comfortable one. But if we can just sort of break that down a little bit and make people more conscious of the fact that actually my actions have negative consequences on others, and am I comfortable with that? And look, if you're comfortable with that, then off you go. I'm not going to be able to change your mind. But I think just highlighting those connections into the problems that we're experiencing, but also the potential to solve them through collaboration, coordination, communication. Human beings are pretty impressive in terms of what we're capable of. So I haven't yet lost hope that we can slow, halt, and reverse some of these horribly damaging processes that we're undertaking, wiping out other species and, burning the planet and potentially wiping out ourselves. We have the power to get ourselves back on course, but it's going to require a more collective and coordinated collaborative effort.
And while I'm absolutely aligned with you on the personal choice front and that our actions, if you, in my experience, if you try to do everything, you will drown under.
Yeah, I agree.
Because
you've got to pick your battles.
The absolute fact is, I live inside a system that it is almost impossible to escape some negative consequences of. I can try to cause as little harm as I can.
Yeah.
Yet it is. I mean, I don't eat animal products. I'm plant-based, but I'm sitting in my office right now. If you're not watching this, there's probably 100 things in this room that an animal died to make. All right. But I am at peace with that because that is, I just am. Because I can't achieve purity. There is no purity. And you wrote in your book, you felt shitty about flying so much. And I get that. And I too pay my bloody carbon offset every time because that is my personal choice. But the other side of the coin, which you didn't mention, and I'm happy to say it if, is there's also a massive agitation. Like, yes, I will pay my extra couple of bucks to offset my my flight. But fuck you, Qantas. You should fucking do that. That is bullshit that you operate like that. And instead saying it's my choice and my decision, do not pass that burden on to me. You're the guys burning the fuel. And yes, I want to get from here to there, but you are human beings who know too much to know that this is not an okay thing. So do your best to cause less harm. And holding our institutions and our systems to the same account, I think, is very important. I love flying. I love travel. There's ways to do it without jet fuel. Okay, they really are. But economically, right now, the planes are designed. We just don't have the scale of the economy of scale right now to put those things into production. But with enough agitation and enough pushing, it's okay. It can happen. And I think it's important that we do that we push our systems to be as aware as we're trying to be.
I agree with you. And I think it would be ideal if the for-profit sector, companies, industries like the airline industry did take responsibility for that, did put in place those positive changes and steps themselves, which some of them are doing to some degree, but it's nothing like the level of commitment that we need, which thus makes it a political imperative. And this is where it gets really frustrating because
it's true.
In Australia, for some weird reason, we just have this high-speed rotation of politics in terms of how often we have, elections and whatnot, which means that, politics is inherently an extremely selfish and self-protective kind of activity. But then we sort of make it all the worse by having these extremely short timelines in which we expect our politicians to operate. And then we sort of act all surprised when they don't have the guts to commit to long-term decisions that are going to benefit us all together beyond the next election cycle. So this is one of the real kind of sort of frustrating aspects of our current sort of socioeconomic system, if you can call it that. It's not just unique to Australia, by the way, but we're both Australian. We're talking largely about Australia here. I have this would fervently love to see some more intelligent and informed and ambitious and committed decisions being made with respect to what we need in the long term for our collective benefit. And there are clever people around there, sort of involved in or orbiting politics that know very clearly what needs to be done, and we just need politicians who are willing to listen and make the tough decisions.
It was said to me about my drinking when I first complained. It's like, why isn't it better yet? It's like, how long did it take you drinking to get this bad? I said, I probably started when I was about 14. I stopped drinking at 36. Okay, right. That's 18 straight years. And you want it to be better in 10 weeks? Okay. It's going to take longer, mate. And for me, I think that's the big struggle, is knowing what needs to be done, but also understanding it took a real long time for these systems to get to this place.
Yeah.
Moving as fast as we possibly can, it's still going to take longer than I am okay with to get better. But I have to believe that every single day it gets a tiny, tiny bit better. I have to believe that.
I admire the title of your podcast, which reflects precisely that sentiment, right? I like you, think if we just sort of let ourselves be overwhelmed by the complexity of all these challenges that we're facing, we just be paralyzed and never get out of bed. So we have to believe that things can get better, and we have to pick our own battles and be willing to say, okay, I have the energy and bandwidth and commitment to be able to do this, but just not this. Again, it's just a sort of self-preservation measure. But what I do think it's important to be clear about is that the rate of change in society, in this period we're living in, is unprecedented. So things have been basically speeding up since the Industrial Revolution, and then we've had this sort of fourth Industrial Revolution, living in the digital age, and now everything is changing exponentially now, including atmospheric carbon dioxide concentrations. So we don't have the luxury of time that we have had in any other period in human history. So we are fucking a lot of things up, and we have to acknowledge that and act quickly, because we don't have the same kind of luxury of leisurely sorting things out that we've had in the past.
With that action comes extraordinary possibility and a huge upside, because of the nature of the kinds of change that need to happen. Oh, what? You want to run an economy on a kind of fuel that has to get dug up out of the ground and then shipped away on the other side of the world and then burned? What if we gave you free energy? You just have to put this stuff on your roof. Oh, what could you make then? That'd be all right, wouldn't it? The upsides are humongous. And looking at through that lens is also really, really important. That, I don't know, like, does it mean that the aforementioned systems, that some of them are still in place and echoes of the colonialism that has, to a large part, contributed to a lot of these problems, might start to get dismantled? That's exciting. These things could happen. I'd like to think so.
Hope springs eternal. Yeah.
You mentioned it. I mean, you talk about it quite generously in your book. You talk about the struggles that you face, and it's not uncommon. I mean, I was speaking to some ambos the other day. It's like part of your job, like you have two jobs. One, help people who are having the worst day of their life, and two, make sure you don't catch PTSD while you're out there. Like every single day you're attending road trauma, or some horrible domestic violence situation or something like that. You're there to help someone and make sure you don't take that shit home. Like it's equally weighted. So for your job, that is a huge part, and keeping yourself. And you talk about how it wasn't always top of your list, and in the systems you were operating in, long hours, vending machines, for months on end. My mum and dad talk about when they were on shift together, they would swap out of the same bed in a ward that was one would sleep while the other would go and work, and one would sleep because they worked in the same hospital in Stoke-on-Kent. Now, after all the stuff you've been through, how now do you, what practices do you have to maintain kind of resilience around the kind of work that you're doing? What stuff in your own day-to-day do you do to make sure, right, I am as powerful as I can be to take this?
Yeah. Look, thanks for bringing it up. It's a very topical issue at the moment, right? There's a number of books out there written by doctors at the moment that many of which have slightly different angles on this issue. Some of them speaking from very personal experience, some more kind of obliquely in a fictional way, but still highlighting the issues. And yeah, my own humble little story, in life and death decisions, is main focus of the book is not about the risk or phenomenon of burnout in the medical workforce, but I certainly do have my own experience to share with that. And what I think is most disturbing is that there's nothing special or rare about my experience. I don't think you'd find a doctor. I mean, you mentioned your parents. This has been going on a long time, and it's not just doctors, by the way. But I think of health professionals, doctors, in many ways, have the highest expectations put on them, along with the least realistic expectations. So I use the examples of pilots, right? So pilots have our lives in our hands every time we get in a plane and fly with them. They also have very, very strict regulations around fatigue in particular, and when they're allowed to fly or not. And this is something that I sort of interact with on an almost daily basis, because with some of the emergency telemedicine work I do, I'm helping coordinate aeromedical retrievals. And it's very common for us not to be able to move a critically ill or injured patient from a remote location because the pilots can't fly because they've gone over their fatigue limit. Where does that exist in the medical system? Yeah, the way we treat doctors, and I say particularly junior doctors, is just absurd in terms of what we try and squeeze out of the poor buggers. And then it should be no surprise then, and I say that a bit flippantly, but it's a tragedy that doctors have the highest rates of suicide of any industry, and we're seeing junior doctor burnout more sort of prominently at the moment than we almost ever have. And that's not because it's necessarily worse than it's ever been. It's just because these poor guys are like, shit, we need to discuss this a bit more openly. So I think we need to be a lot more compassionate about how we treat our health professionals who we are entrusting to care for us, but we're kind of not caring for them or letting them care for themselves. And to answer your question about how I deal with it, it's a very humbling experience, as I believe you have been through and many people have been through, to come face to face with the limits, with your own limits of what you can handle, and realize that you have not just met them but exceeded them. Yeah. And in my case, when I just imploded, burnout, suicidal depression, the whole thing, however you want to kind of frame it, it's what happened. Caved in on myself like a neutron star. Firstly, it took a lot of blood and sweat and time and love and support to clamber out of that. And then the partly humbling, partly very illuminating experience of that was like, okay, well, I know what it's like now, and I'm not immune to it. I'm not invulnerable. And so now the best I can hope for is that firstly, I'm trying to minimize the risks of me getting to that point again. So I'm trying not to work completely insane hours. I'm trying to make sure I get enough sleep, that I'm eating right, I'm able to do some exercise, and avoiding the intoxicants, to a reasonable extent. Just doing all those right things. But then also, despite my best efforts, if I see that I'm coming up against those limits, you got to know yourself and be kind enough to yourself to do something about it. So there's been times kind of going through a bit of a period at the moment where I'm like, it's getting close. I got to find a new equilibrium here, because otherwise, things are going to get completely off balance and down I shall spiral once again. It's not acceptable. No use to anyone if you're completely broken.
No, absolutely not. And you certainly don't want to take the people around you down with you. And it is in that state. And I'm fortunate that I'm in a loving relationship, but there are people that are single or they are alone, and so it is somewhat trickier to find people who will say, "You might think you're okay, but I know you and you're not. So you need to go see your doctor." And Audrey has said that to me more than once, and I know that if my brain goes, "Well, what does she know?" I'm like, "Aha, that's the voice that tells me."
Yeah.
If that's going, then I'm going to see my psychiatrist tomorrow, because it's recognizing that voice of denial because I trust her so much. And then, okay, I should get back on meds. Yeah, good idea.
Mm.
And I did, and it was great. But it's this idea that, even you're working in Switzerland, you're, at the top end of, policy and like the cutting edge of like, how do we, humongous complex problems. Super, 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 super smart person, went to Moscow as a young scientist, like incredible. And yet your ideas aren't enough to cope. And doctors are the shittest patients always. And I know, because both my parents were doctors, and like, man, they are bad. They do not do what they get told, because they think, oh, you don't understand, I'm the smartest person I ever knew, so why would I listen to anybody else? What's it like for you? What's it like for you then to go, I'm actually going to need someone else's ideas here. I might have to go talk to someone.
Yeah, well, for me, it's not a question of being smart. It's the expectations you put on yourself as well. If we have committed our careers and our lives effectively to helping other people, that on the one hand it's weird, but on the other hand it's logical. That takes precedence over everything else. And so I think a lot of doctors and other health professionals and other professions as well will be almost sort of self-destructively committed to helping others. And I think I can look back on my life and see little shades of that, and it's this extra sort of psychological and emotional step to go, hang on, I'm putting myself at risk here, and I'm it's sort of living my life in an unhealthy way, and at some point inevitably that's going to compromise your ability to help others. And the worst case scenario, I think, is you've got to avoid at all costs, is getting to the point where you're not safe to be caring for others because you are so fatigued or so stressed or distracted or otherwise compromised. That's the thing to be avoided at all costs.
What are your, like, just for people listening, what are the things that you watch out for? What are the things that you take, the signs that you take notice of in your own self?
Oh, look, fatigue is a big one for me. I live a pretty high tempo lifestyle in many respects, but I get tired, and as my wife would be the first to attest, it's pretty obvious when I'm tired. I'm short tempered, it's kind of irritable.
Mate, we're all just big toddlers, lot. Come on, it's fine.
Yeah, exactly,
we're all just big. If we haven't eaten, if we haven't slept, if we need to shit, we all get upset. It's
grumpy.
Fine.
Yeah,
we do.
And my lovely wife sort of looks after me, but she's not the only one that's ever done that. Like, I've worked with some wonderful nurses in hospitals over the years who didn't even need to say anything. It'd just be like, sort of whatever, 10 p.m. or 3 a.m. or 11 a.m. or whatever, and just this sort of cup of tea and a biscuit would be slid in front of me. Look around and go, what's that? And I was like, okay, message received. I was being a bit of a grumpy arsehole, was I? And they're like, just needed some caffeine and a sugar hit. So I think fatigue's a big one. And I've already kind of made the point about, I think, how we have unrealistic expectations of how much doctors can work. First and foremost, I'm a rural generalist, and so many of my colleagues are out there in rural and remote communities, often as the only doctor in that town, and that is just punishing. That is crippling, and it's not fair. It's inhumane. I don't know how these guys do it. Power to them. I'll be humble enough to say I couldn't do it. Not long term. So that's where I think it's so important that we have these sort of, I don't want to say compromises, makes it seem like it's diminishing the quality of care, but these innovative solutions to medical workforce crises. Like, I work for the virtual rural general service in Western New South Wales, and we provide round-the-clock medical care through TV screens to patients in these sites, most of whom have no doctor at all, some of whom have a doctor, but that poor doctor can't be on call for everyone all the time. And it's those kind of solutions, I think, are imperfect, but they are essential to enable people, as we were discussing earlier, even in the most remote disadvantaged communities, to have access to medical care when you can't have a perfectly qualified clinician there on site all the time.
Be nice to your doctor, no matter where they are. They might have just come back from doing 18 months in Cooper Pedy, you know, and now they're sitting in your suburban general practice like, this is amazing. I'm like on a tropical holiday. This is incredible.
Well, I mean, how we treat GPs in Australia is pretty appalling, I'd say. Like, you're they're the worst paid specialty, just crazy kind of work-life balance, 15-minute billings, Medicare, not even coming close to compensating for what their work. You know, that's a whole other Pandora's box.
I remember when my mom, when her practice as a GP, when her practice got absorbed by a conglomerate, and she started going like, I'm 64. I've got a type. I've handwritten everything my whole career. I can only see people 15 minutes. She says, medicine takes longer than 15 minutes. Yeah. What is this? I can't find out what needs to go on. What the? Yeah. So you're not Robinson Crusoe there. It's mate. I could talk to you. I could talk to you all night, dude. I really could. But I know you've got a busy day.
I really appreciate your interest, Osher, and for taking the time to chat.
Mate, of course.
Good luck with the hip.
Mate.
And your energy, your positive energy, is truly infectious, mate, in the best possible way. So good on you for having this podcast with the beautiful spirit that it brings. It's been a privilege to chat to you. It's been a great fun as well.